Good Wednesday afternoon to you, everybody. My name is Adam Cook. I'm Telile's news host and producer, and I'm here to guide you through the COVID-19 media briefing for Nova Scotia, hosted this afternoon by Premier Tim Houston and by Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. We're in day 10 of the Phase 1 reopening strategy for Nova Scotia. That's scheduled to last until mid-March, with Phase 2 coming on from mid-March to the middle of April, and a full reopening taking place from mid-April to mid-May as we head towards living with COVID-19 here in Nova Scotia. So right now we're going to give you an update on the numbers for today, Wednesday, February the 23rd. There have been some shifts in numbers for both case numbers for Nova Scotia for COVID-19 and hospitalizations. Let's break it down to you. Today, Nova Scotia is reporting 3 new hospital admissions and 4 discharges. So what that means is that there are 49 people in hospitals across the province who were admitted due to COVID-19 and are receiving specialized care in a COVID-19 designated unit. That includes 11 people in intensive care. We can also tell you there are 2 other groups of people in Nova Scotia hospitals related to COVID-19. 125 people who were identified as positive upon arrival at a hospital but were admitted for another medical reason, or were admitted for COVID-19 but no longer require specialized care. There are also 178 people who contracted COVID-19 after being admitted to hospital. So when you add all that up, that's 352 people in hospitals across Nova Scotia as a result of COVID-19. That's been the number for the last week and a half. It's been circling around 350 and 360 hospitalized here in Nova Scotia due to COVID-19. So we're keeping an eye on those numbers for you. But we're also keeping an eye on case numbers for COVID-19. And we can report to you that as of February 22nd, yesterday, the Nova Scotia Health Authority had completed 1,617 tests in their labs, and an additional 200 new lab-confirmed cases of COVID-19 are being reported. Of those 200, there are 63 cases in the Central Zone, 52 cases here in the Eastern Zone, comprising all of Cape Breton Island and Antigonish and Guysborough counties, and 39 cases in the Northern Zone and 46 cases in the Western Zone. And as of today, there are an estimated 1,898 active cases of COVID-19 here in Nova Scotia. So those numbers are dropping. It wasn't all that long ago that we had close to 6,000 active cases of COVID-19 in Nova Scotia, and we were also seeing upwards of 1,000 cases being announced per day. That number having dropped to 200 per day, certainly seeing a significant downturn in the case numbers, both the daily cases and the overall active cases. So that's what you need to know as we head into this press conference. We're going to hear from Nova Scotia's Chief Medical Officer of Health in just a moment. Once again, we'd like to thank Communications Nova Scotia for providing us with the audio for this recording. And we're going to begin, as always, with remarks from the Premier of Nova Scotia, Tim Houston.
We can all agree that this has been a long run. Over the last 2 years, we've been through an unimaginable journey as a province, as Nova Scotians. We've seen tragedies that are unparalleled. We've experienced all the ups and downs of COVID itself. We've mourned together for those who have lost loved ones. We've celebrated together when the virus eased and restrictions allowed. We delayed weddings, funerals, birthdays, and delayed hugs. We haven't seen our grandchildren. But we did come out in incredible numbers to support our families, friends, neighbors, and really our entire province by getting vaccinated. Our healthcare professionals stepped up when we needed them most, time and time again. They answered the call. They worked countless hours, days, and months, really, in impossible conditions. And many put themselves at risk, all in the name of our public safety and in the name of duty. And then there's one person who made Nova Scotia a real leader in pandemic response. He's become a national leader in so many ways. Many chief medical officers across the country look to our own for guidance. So I will say that appreciation that I and that Nova Scotians have for your service, Dr. Strang, can't be properly articulated. So we thank you, Dr. Strang. You are one of a kind. And having had the opportunity to sit beside you and work with your team over the past 6 months, it's been an incredible honor. The more I get to know Dr. Strang, the more respect I have for you and your family. So I want to really thank you for that. And I do want to thank you for taking it easy on your third premiere on this journey.
The last couple of months easy, but
no, normally, at this point, I would be talking about case counts and hospitalizations in my remarks. But today is different, and that's because, we know that COVID-0 it's not a reality. Certainly not right now. Someday, hopefully, maybe it will be, but it's not right now. Living with COVID, that's the reality. That has to become our new reality. And I know, and I respect that is a scary thought for some Nova Scotians. Many people have felt protected by the restrictions, and they've seen the restrictions as the sense of security that they are and that they were meant to be. I understand that, and certainly as I say this, I'm thinking of my own mom, who has been very nervous to leave the house for 2 years. For others, I know on the other side, it feels like we've had restraints on them that have stopped them from being able to really live their lives. And they've missed their children's sports and dance recitals, and to them, to you, I know you want your life back to normal. So today, you should see this as the announcing of a return to normalcy. And in many ways, this road to normalcy, it's going to be a long road. We live in increasingly divided communities. And sadly, some relationships have been broken beyond repair. Some personal relationships have been broken beyond repair over the last 2 years, but certainly the last few months. Others in time can be mended, and that's my hope. But it's up to each of us to play a part in healing our communities. We can have different opinions on the path to return to normal, how fast, how slow. We can have different opinions on that. But we need to get back to a place, a respectful place, where we find ways to respectfully disagree, where we find ways, places that we can constantly remember that at our very core, as Nova Scotians, as Blue Nosers, we care about each other. That's the place where I hope we can get to, a place where we stop viciously attacking those with different opinions. And we remember that we're all on the same team, because we are all on the same team. And our leadership team works very closely and follows the advice of public health. And as I've said, that advice is that assuming everything stays on course, effective March 21st, all remaining COVID restrictions will be gone. Between now and then, restrictions will methodically fall away. There comes a point in time where the benefit of the restrictions is outweighed by the impact of those restrictions, particularly on our children, on our seniors, and on our collective mental well-being. We've reached that point. We've always said we would follow the science, and the science is saying we're ready. There will be some that say it's not fast enough. Others will say it's too fast. But the reality is that the pace we are moving, and the pace we will move over the next month, is right for our situation in our province. So as we await for March 21st, we'll still work through short phases that gradually layer on additional risk. Some things will happen quicker, like the removing of remaining restrictions around participating in sports and arts and cultural activities. So tournaments and performances will be back soon. Kids can get back to full-on playing and performing just like before. All of this stuff will be part of a more comprehensive Phase 2, which will begin March 7th. But even before that, even before March 7th, we will see the removal of the proof of vaccine. The proof of vaccine will be eliminated on Monday, March 28th. The proof of vaccine has served its purpose. It has served Nova Scotians well. But it was only ever meant as a temporary measure, and its time has come. We collectively know more about COVID. Individually, we know more about COVID. There is less uncertainty now. Vaccination rates are high. Access to vaccines is not an issue. We can wear our masks if we choose. We can keep our distance if we choose. We've had time to understand the social impacts. And now people have the tools that they can use to protect themselves. And we are at a point where we have to have confidence in Nova Scotians' ability to use the tools available to them without the government telling them that they have to. It's time. So Dr. Strang will give you more details on what the rollout of the phases actually looks like. Dr. Strang.
Thank you, Premier, and thank you for your kind words. And I just have to say that I have the privilege every time I'm up here with you or previous premiers. It's been my privilege to represent very dedicated and highly skilled colleagues on my team in public health and many professionals across the healthcare system. Those are the ones who really deserve the thanks. But thank you, and good afternoon to everybody. Before I start, I want to acknowledge that the crew of HMCS Halifax, who are about to embark on a NATO trip related to a situation in the Ukraine. Thanks to that crew for standing on guard for all of us, and be safe. As the Premier said, the situation in Nova Scotia is slowly improving. A week and a half into our reopening, and key indicators continue to trend in the right direction. Vaccine coverage is still going up as children in the 5 to 12 age group get their second doses and more people receive their booster doses. Our lab-confirmed numbers continue to go downward. Outbreaks in group settings like long-term care and more vulnerable communities are coming to an end. And there are more people being discharged from hospital than are being admitted with COVID-19, which means fewer people in hospital overall due to COVID. Where we are today is the direct result of the work we've done together over the past 2 years. The sacrifices you've all made as individuals. The public health measures we've deployed when we needed them. And the COVID-19 vaccines that continue to play an incredibly important role during this transition phase. However, we have to remember our acute care system is still under tremendous strain and recovery will be slow, but it will happen. So I want to share a few more details with you about our plan to loosen restrictions and the changes being announced today. As the Premier said, we are removing the need for proof of vaccine for discretionary activities, so going to restaurants, fitness facilities, participating in sports and arts and culture events on February 28th. You will still need to show your proof of vaccine, however, in high-risk settings like hospitals and long-term care homes for a while longer, and vaccine mandates for employees in high-risk sectors like healthcare are still in place for now, and we will have more to say on those in the coming days. Proof of vaccination for discretionary activities was always meant to be a temporary measure to protect Nova Scotians. And after nearly 5 months, we're in a place now where it's no longer required for day-to-day activities. Most people 18 and over have had an opportunity to get their full series of COVID-19 vaccine and a booster dose. And by the way, we are up there with Newfoundland leading the country in our percentage of the population who are eligible who have had a booster dose. And children 5 years of age and over have had an opportunity to get their full series as well. Our level of immunity, both from vaccine and recovery from recent COVID infection, is very high. Phase 2 will now begin a week earlier on March 7th with some adjustments. Effective March 7th, restaurants and bars, fitness facilities, and movie theaters will be able to operate at 75% capacity, with distancing as much as can be achieved within their specific physical space. And the same goes for events, including tournaments and competitions, faith gatherings, receptions, meetings, and so on. The informal gathering limit will remain the same for indoors at 25, but will increase to 50 outdoors. Masks will still be required in indoor public places, including restaurants, gatherings, and events. But starting on March the 7th, you will be able to remove your mask to eat or drink while in your seat at events like at a movie, a concert, or a sports event. We all know that there is some risk of exposure when we're out and about, but we also know how to reduce our risk. And we know to stay home and get tested if we develop cold or flu-like symptoms, even if they are mild. So as of March the 7th, along with our phase 2 changes, we will no longer be asking people who test positive for COVID to tell their close contacts except for the people they live with, although they can still do so if they want to. And people living with a confirmed case will no longer be required to isolate as long as they do not have symptoms. More details on this and the steps to take, including around testing, will be available starting on March the 7th on the Nova Scotia Health Authority's website. And we will also be moving from daily to weekly reporting in phase 2. So starting the week of March the 7th, we will start our weekly reporting. And all more details on phase 2 are included in today's press release, and we're working on updating our website now. Phase 2 will last for 2 weeks, and we'll be monitoring our usual indicators closely during that time. And if everything remains stable, we will move to phase 3 on March the 21st. And at that point, restrictions and mandates will end. There will no longer be gathering limits. There won't be any capacity limits for businesses. Masks will no longer be required in indoor public places, but we will still recommend that people wear them. And there will be no requirement for physical distancing, although, again, you can still do so if you want to. In public schools, there won't be any change until phase 3. The measures that are in place now, such as cohorting and masking, will stay the same until March break. And when students and teachers return on March the 21st, it will be to schools and classrooms with no restrictions or required measures. For many, this is welcome news. It has been a long 2 years with a lot of uncertainty, stress, and heartache, and that's true for all of us. But for those who have lost loved ones, those who work in healthcare, long-term care, and schools, those who own their own business or work in the entertainment and service industries, it has been particularly difficult. There are a lot of people who are ready to get back to something that more closely resembles life before this pandemic. But for others, the idea of having no restrictions, of going back to the way things were before, comes with its own uncertainty and stress. That is understandable and quite normal. Restrictions played a necessary and important role in our response to COVID-19. They helped contain the spread of the virus in the first 3 waves before we had good vaccine coverage, and they were critical in reducing the impact of the Delta and Omicron waves. But they were never meant to be a permanent solution. We always knew that they'd be lifted at some point. And now it is time to move away from 2 years of crisis response and approach living with COVID in a long-term and manageable manner. There is risk, of course, but that would be true if we did it last week or 2 months from now. There is no textbook that lays out for us exactly when and how to do this. It's a balance, the same balance that we've tried to achieve over the last 2 years, balancing doing what's in the best interest to limit the impact of a new virus with the impact of the restrictions themselves, and what they have on our individual and collective well-being in our economy. But I truly believe that we are ready, that Nova Scotians are ready. We have the tools to manage COVID. Big things like contact tracing, testing, restrictions, and vaccines that have set Nova Scotia apart from others and often put us at the head of the pack, that we're phasing those out over time. But we have other things too that will remain, and they are available anytime to all of us to use when we need them. We can stay home when we're sick with cold or flu-like symptoms. We can get tested when we have symptoms or are planning on visiting people at high risk for severe disease. We can continue to wash our hands and clean high-touch surfaces. We can continue to wear masks in indoor public places where distancing is not possible. And we can continue to be careful and cautious about the number of people in our close social circles. And we should continue to do all those things as part of our new normal that has greater respect for COVID, influenza, and many other types of infections. It's how we do our part to keep each other safe, especially those most vulnerable to severe disease. COVID is now moving in two very different ways in our communities. For most, vaccines now mean that COVID is a mild to moderate disease that will not place us in hospital or put us at risk of dying. Although we have to pay attention to the evolving evidence for some people of long-term impacts. And for the older Nova Scotians, especially those in group living settings like long-term care, for people with underlying medical conditions, especially if they're immune compromised, and for the few who cannot be vaccinated, there is still a very real risk of severe disease and even death. As we lift restrictions, our choices and actions become even more important. They will be the tools that we have to limit the spread of COVID-19 and protect those around us who are more vulnerable. These family members, friends, neighbors, and colleagues are depending on each of us to be responsible and keep doing the things that have kept ourselves and others safe for the past 2 years. And it's also important to acknowledge that there are families, larger groups within our communities, and some communities within our province who have needed and will continue to need more support than others. The COVID-19 pandemic has been a stark reminder that we are not all at the same starting place when it comes to protecting our health. Recognizing this and acting on it is an important way we can do better as we move beyond the crisis phase of the pandemic. Today's announcement does not mean that the pandemic is over and COVID is gone. Far from it. There is still a lot of virus circulating in our communities, but now we have the protection of vaccines and the experience to know what to do to protect ourselves and others, which means it's time for a new approach to managing COVID, one that hopefully helps us all get back to the people and places and things we love. And we can do that safely by keeping the same things front and center that we always have: caring, compassion, and community. Tina.
We'll start with Callum Smith from Global. Go ahead, Callum.
Thank you, Dr. Strang. I wonder what today means to you, highlighting this plan after the 2 years that we've already discussed. How significant of a milestone is this?
Today's a very significant day. I had lots of emotions, yesterday and finalizing my remarks last night. This is a major transition piece from our, clear steps forward. Again, we always epidemiologic dependent, but a clear path forward into. And again, I have to emphasize, the pandemic is not over, but it's a clear path into the longer-term phase of how we adapt with COVID along with other viruses and minimize their impact for the long term. So it's a major day, and there's lots of feelings and thoughts and emotions in my head.
Go ahead, Callum, with your follow-up.
Premier, both of you gentlemen alluded to division or different opinions amongst the general population, and you talked about the need to get back to the Nova Scotia that we were. How do you think that happens? Are you confident that will happen, or is there damage from COVID opinions, I guess, that have severely had a long-term impact?
Thank you, Callum. It's an important question. I have great confidence in Nova Scotians that we do look out for one another. We do care about one another, but there is a lot of emotion, and there's incredible amount of division, and I do think that sadly some relationships will have been broken by what's happened here. But I believe that the vast majority will be mended when we can kind of move past this together without the division of who's vaccinated, who's not, and just kind of really come back together and remind ourselves what we care about. What we care about is our family, our friends, and our communities. That's at the core of every Nova Scotian. So I have great confidence in the future of this province.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks. Dr. Strang, this is quite a shift from what we heard about and what we were told might be possible a few weeks ago when you and the Premier first released the reopening plan. So I'm wondering if this shift is a result of a recommendation that public health brought to the government, or is this something that came about following conversation between the government and public health?
So I don't really distinguish between government and public health. We're part of government. Government elected officials make final decisions. So, ongoing conversations. What we laid out a few weeks ago, that was not written in stone, and we caveated it about a month. And as we've seen now over the last couple of weeks, the epidemiologic trends that the last briefing I pointed to that were starting to look like they were going in the right direction, they have continued to that, and so we're more comfortable with more certainty about where the path that we're on. So I've been at this for 2 years with a third premier, that we've had a number of issues that, different challenging issues, that there's no easy decisions. And my job is to bring in the public health perspective and to be part of conversations that many other perspectives have to be weighed in as well. And then making a decision, balancing all those. And I'm very comfortable that we have a very reasonable balance of all those different perspectives, including the public health perspective, in what we're announcing today.
And so, Premier, on that idea of balancing various voices and considerations, to what degree was the decision to do this, because ultimately you're the guy who makes the call, to what degree was it influenced by the fact that it seems like every other province has kicked up the speed for reopening, and there's a segment of the public that's become far more vocal about their distaste for these restrictions?
Yeah, I think what I would say is what happened in other jurisdictions. I mean, it's just a piece of information, but always the Nova Scotia data points have been the points that public health has been concerned about, that elected officials have always been respectful of. So, we laid out a plan a couple weeks ago, I guess, and I've tell you, I got a lot of grief from that, because what are the dates? What are the actual triggers? Right? There was a lot of grief. So, I think at that time, what we were trying to signal to people is that the change was coming. The restrictions would fall away, and we know that some people need to mentally prepare themselves for that. Today, we're also signaling to people that, there'll be, around the removal of the proof of vaccine, there's still issues to work out in certain workplaces, So, but we're signaling today that those changes are coming as well. So, we look at a lot of data points, but I think the data points for this province, the return to school was, a lot of people said that's a big mistake. You shouldn't do that. I mean, I even saw some media reports saying it won't last a week. They'll be shutting it back down. The return to school has it's not been without its challenges, but it's shown to be the right decision. A couple weeks ago now we loosened up again. So we're looking at what's happening in this province. That's the most important factor in these decisions. Considering the emotions of people, I do think that we weigh up the mental health of Nova Scotians. This has been tough. And it's weighing on people very heavily, and we have to be mindful of the decisions we take and the impact that they have on people in terms of crushing people with decisions we make. So this is as I said, this is not fast enough for some people, too fast for others, but it's just right for Nova Scotia when you consider our own situation here.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Dr. Strang, I wonder if you could just speak a little bit to the COVID deaths we're still experiencing and put that in some sort of context. I'm thinking last time we had numbers, it was probably a month ago or so, you said something like 30% of the people dying were unvaccinated. Has that percentage changed? And is it the fact that because we're so highly vaccinated in Nova Scotia, that just necessarily a greater percentage of the people dying are vaccinated, but the total number of deaths is lower compared to elsewhere? If you get what I'm asking you.
Yeah, there's a lot in there. So yeah, our deaths, haven't looked at the very latest, but I think it's holding about, that less than 7% of our population who are eligible to be vaccinated are unvaccinated, but they're still representing about a third of deaths. So there's a disproportionate impact on both severe disease and hospitalization and death of those who are unvaccinated, and that is consistent. There's national data, the same thing. But what we're seeing in their deaths now, we have to remember that the deaths are reflective of the disease activity several weeks ago. because there's all the time lag between people getting infected and then getting severely ill and hospitalized and dying. So there were a lot of questions recently about, well, how can you do this when there's with such a high death rate even a week ago? Well, those deaths they're not reflective of what's currently going on, and we are starting to see the death rate go down. So I don't know if I'm answering your question, but there still is this very disproportionate impact on severe disease and death for those who remain unvaccinated. And you've given me the opportunity, I'll take it, that it's still, there are that 6.7% who can get vaccinated who aren't, it's still not too late. There's still time to protect yourself, still time to protect others around you. And then so we have lots of vaccine and lots of access to vaccine.
Go ahead with your follow-up, Tim.
Premier, you ran on a platform in large part addressing healthcare issues. I think, not to put COVID entirely in the rearview mirror at this point, but I think it showed that just a relatively small outbreak in Nova Scotia compared to elsewhere really stressed the hospital system. And it's argued that, had we had the hospital system we had 2-3 decades ago, that stressor wouldn't have happened. How does that experience inform you about where we need to go with our healthcare expenditures and building our hospital system into the future?
It's absolutely true that the significant weaknesses and deficiencies of our healthcare system have been laid totally bare for everyone to see. Most Nova Scotians knew they existed, had seen about them in some way, shape, or form, heard about them, but they are extremely obvious to people now. So two things that have kind of been confirmed for me. One, we have incredible people working in healthcare. I mean, what they've dedicated to Nova Scotians and how they've stepped up is pretty remarkable. But it's also given me more resolve to address the issues that we knew existed. So I think over the next couple of weeks, certainly the COVID situation has consumed a lot of time and effort and focus, rightfully so. But there's lots of issues to be focused on. So I think with the resumption of the legislature and heading into the budget season, you'll see a lot of talk on things that can and will be done in healthcare. We've made a lot of strides in certain areas, incremental changes that will have positive effects, but there's a long way to go. And what I would say to Nova Scotians is I'm even more committed right now than I was on August 17th. I know absolutely what I need to do, and I will give everything I have to do it.
We'll go to the phone lines now and take some questions from reporters on the phone. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Dr. String. I'm wondering if you could talk about masks and why there's still going to be a requirement for indoors. I think people kind of make the link, rightly or wrongly, with masks and the proof of vaccination, right? They kind of go hand in hand, yet we're dropping the proof of vaccination, continuing with masks. So I wonder if you could just talk about why you think it's important to keep this measure in place, regardless of the fact that we're getting rid of almost all of our restrictions.
I mean, they have different purposes. Proof of vaccination is around, as we had a lot, had people getting together when there's lots of virus around, making sure that we were reducing the ability of the virus to spread, and especially people were getting together were at the lowest risk from vaccination of getting severe disease. Masks have all along, and we've had masks since August of 2020. Masks have it very clear that they play a critical role in limiting the transmission of the virus. If I'm infected, a mask properly worn really reduces the amount of vaccine that goes out into the close airspace around me, and we know now it's that close shared airspace that is really a driver of transmission. So even as we're opening up, we still need to, again, taking on each phase in reopening, it takes on a bit more risk, but we can't, keeping the mask as a way to mitigate the risk now until March the 21st. And even though then we're at a point where I'm comfortable saying we no longer require it, still strongly recommend that people continue to wear masks, and I have said this before. I hope that we retain a much stronger kind of culture of wearing masks in the future, especially during the winter months. Because if we all wear masks when we're around other people and can't be distanced, especially in areas of indoor shared airspace, that will help prevent the spread of, if COVID is still around, of influenza, all the viruses that cause the common cold and a bunch of things. Better mask use by choice will actually have a significant contributor to our longer term health. So, but again, there's a difference between requiring it as a time limited tool because of a pandemic, and then promoting it and encouraging and supporting people to wear it by choice as a longer term measure.
Go ahead, Keith, with your follow-up.
And continuing with that, if you want people to continue to wear it, is it fair to say that masks have been perhaps the key to all these measures? I mean, vaccination obviously is tremendously important, but masks themselves, have they been just absolutely crucial in trying to rein in this virus?
Masks have been, there's no one thing that's been it up. Masks have been very important, but again, you may have heard me and other folks, the Swiss cheese analogy. Every different measure we have in place, they all have holes. None of them are perfect. And if you just have one, there's lots of holes for the virus to get through. But if you stack them all up, then you actually have a solid wall. So it's the package of things that go together that have been important. And again, but we're changing that. We're in a place now where we still want people to build in on many of those things in their personal lives, and the choices that they make is around masking, or as I've gone through my remarks, we still have the responsibility to be COVID safe. It's just that we're in a place now that we can transition from requiring it to asking people to do it.
Next, we'll go to Jonathan McGinnis from CTV. Go ahead, Jonathan.
Hi, Dr. Strang. I'm just curious what you're anticipating will happen once these restrictions are lifted. Do you anticipate seeing an increase in COVID numbers?
So I think the national modeling that was released last week shows that if as we lift measures, there's going to be some increased transmission. So we might well see, that that the progress we're making and the decline of cases may slow down somewhat. But again, a lot of that depends on actually what choices we make. So just because we're not requiring things, and we sound a bit like a broken record, doesn't mean that people shouldn't keep doing certain things by choice, especially for those around them who are more vulnerable to severe disease. So the impact of this actually depends a lot on how well Nova Scotians continue to adhere to the basic personal protective measures that we have been using for the last 2 years.
Go ahead, Jonathan, with your follow-up.
What is your level of concern regarding the amount of people that are still in hospital? There are some, I'm thinking more of rural hospitals, I'm not sure what the city numbers are, but they're either at or above capacity right now.
So I break it down. So from a public health perspective, we look at what is the average number of weekly new admissions, and that is well trending downwards, and because that is a reflection of the virus activity in the community, and that's trending in very well in a good place. The sustained high numbers of people in hospital, they're more about the capacity of the healthcare system, and they're certainly COVID has exacerbated things, but as the Premier's talked about, they're also reflected of some long-standing challenges in the healthcare system. So as a citizen of Nova Scotia, I am concerned that we have to do, we need better surge capacity in our hospitals, whether it's for the next pandemic, whether it's the next bad flu season, as we talk about climate change and maybe heat emergencies and having a prolonged heat event, which could cause better increase in hospitalizations. We need to invest in our healthcare system and have more flexibility and more surge capacity as events that create health issues happen in communities.
Next, we'll go to Stephen Cook from the Chronicle Herald. Go ahead, Stephen.
Dr. Strang, is there any chance that restrictions, either fully or partially, could come back into effect if there's a sizable wave or a new variant that could come down the pike?
Well, one of the things I was taught in medical school is never say never. We always have to be open to the possibility that a curveball could come at us. We weren't expecting Omicron. We were, I look back in November, December, that Omicron took us all by surprise and I think flattened us because we had expectations that couldn't be met. So we always have to be temper our expectations that we are still in a pandemic and something could come at it. So I will continue to do my job. My team will continue to do the surveillance and monitoring things here in the province and elsewhere. And as things evolve, we will continue to come back and have conversations with the Premier's office. But right now, we're on a good path, but we'll always make sure that we're looking for things and reacting as quickly and as appropriately as is needed.
Go ahead with your follow-up, Stephen.
And for Premier Houston, at your last briefing 2 weeks ago, of course, the wage increase for continuing care assistants came into effect, and I'm wondering if 2 weeks later we're starting to see places being filled, more beds opening up, the positive results that you were hoping for from that wage increase.
Thank you, Stephen. Yeah, so I haven't seen the numbers on, obviously it's going to be a slow grind to get people back to the workforce, to get these beds opened up, but I can tell you there's been a seismic shift in just the optimism and the outlook of those working in healthcare, certainly as CCA. As a matter of fact, two of them stopped me on the street last night and told me what a change this has made in their lives and the lives of their families. So those are good things. We want people to see the important work that CCAs do as a viable career opportunity, and I think that needle is moving in the right direction for sure. Thank you for asking about that.
Next, we'll go to Paul Bacon from allnovascotia.com. Go ahead, Paul.
Good afternoon, Premier. The state of emergency has been extended to March 6th. When will that state of emergency be lifted?
Thank you, Paul, for that. My initial thought is March 21st. We've still got, as I said, there's a couple. Then we want to signal to Nova Scotians that this is coming, and some of these things will require people to kind of really think about and process. There's a couple impacts of that shows itself, as I said, like in the proof of vaccine, what happens in certain workplaces and stuff, and the other place that shows up is in the ramifications of the state of emergency. I know it has some impacts around insurance for some long-term care facilities, certainly around housing there was some impacts. But my expectation is that the state of emergency will be ending when we move to the final phase of which is March 21st.
Go ahead with your follow-up, Paul.
And you've heard Dr. Strang talk about the need for more surge capacity in our hospitals. How will that inform your planned investments in healthcare?
Yeah, I mean, so sort of just as a blanket statement of how we're kind of approaching the crisis that we see in healthcare across many different areas is, of course, we need to add capacity in the form of professional healthcare workers. So we need more people. We need more CCAs. We need more nurses. We need more doctors. So we need people to increase capacity. But the other way we can increase capacity and that we're looking at is innovation and looking at different ways that technology can be used to help people through the process. So all of these things, yes, we need to, there's a long way to go in healthcare. The situation is going to take time and money to address, but we're committed to addressing it. And you'll see that in retention and recruitment. You'll see that in different processes and different innovations and stuff. So we're looking forward to the positive changes, and I know Nova Scotians are as well.
We'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question's for Dr. Strang and Premier Houston. What's your advice to those Nova Scotians who may have mixed feelings about this transition from the restrictions we've had to being restriction-free after 2 years?
Maybe also, first of all, having mixed feelings and feeling some anxiety and some concern about this is normal, and so that's okay. Talk to people about that, but also as we rely on people have lots of things that they can do in terms of what they do to minimize risk in their lives, and if people are feeling concerned, then they need to have conversations around and the people in their lives around them, and really what those people as well are going to do to help. If somebody's at increased risk, well, it's important that they have a conversation with other people in their family about how those other people can also keep them safe as well. So this is about really about being open and having conversations and about asking people about, you may have your own expectations about who gets to come into your house under what circumstances. That's okay. But what we're moving away from is requiring a bunch of stuff to giving that flexibility and that ability for individuals and families to kind of figure out what their risk tolerance is. But there are still lots of tools, and we have lots of information, and we'll continue to have that on our various NSH and government websites to help inform people as they make their own choices and decisions around this.
Yeah, thank you, Pat, and thank you, Dr. Strang, for that. And it's absolutely it's okay. It's normal to have mixed feelings and lots of emotions around it. I know I certainly do on a personal level, but I'd say trust. That the team at Public Health has navigated us through this pandemic. I'd give them glowing reviews, and I think many people around the world would. So I'd say have some trust in what's happening. But yeah, take your steps to keep yourself safe in terms of limiting your own contacts if that's what's comfortable for you, wearing a mask if that's what's comfortable for you. So, but I would say overall it's okay. It's okay to have anxiety. This has been a difficult time, and this is a shift, and shifts come with anxiety. That's okay, but you can also take steps to wearing a mask after this is still okay. So do what you think is necessary and right for your family.
Go ahead, Pat, with your follow-up.
Yes, Premier Houston, with the restrictions easing over the next month, how much longer do you think you'll be holding these COVID-19 briefings?
Well, you're going to miss us, aren't you, Pat? That's why I don't want to. I think that the media will be most disappointed to not see us on a regular basis. But the expectation is, we'll set this path. This may be the last one. It may not. But I mean, we'll be here when it's necessary. If things change, one way or the other, we'll be here. We always look forward to them as well, don't we? I think we do, right?
Absolutely. Highlight of my week.
Next, we'll go to Lois Ann Dort from the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello. Thank you. If and when we no longer have proof of vaccination requirements, will people who lost their employment due to not being vaccinated be allowed to apply for their old job? If their employer doesn't want vaccinated workers, will that be deemed a form of discrimination?
So I mean, we're looking at that right now. What we've, the required vaccination in certain workplaces, that's being examined right now, and all the questions you asked about, what is it, people coming back and under what conditions. Those are all, we'll have more decisions on that. Various employers have to make those decisions. At the end of the day, an individual employer always has the ability to set, vaccination or other things as a condition of employment. They always have to do that with their own appropriate legal and kind of human rights advice that they get to make those individual kind of business or corporate policy decisions.
Go ahead, Lois Ann, with your follow-up.
Okay, thank you. Any thoughts on introducing wastewater surveillance so we don't get caught out by a new wave or a new variant again?
So there's lots of ongoing discussion. That the wastewater surveillance is still really in the research realm. There's a kind of research consortium at a national level that the folks at Dalhousie are part of. We're still connected to that work, but our experience with that is that it may be helpful, but there's still a lot of kind of things that have to be worked out to really be able to rely on wastewater surveillance as a tool in what we call syndromic surveillance, looking for patterns as early warning signals. So there still lots of work to do, and to figure out exactly what role, if any, it might play long term.
And that's all the time we have for questions. Go ahead, Premier.
In thinking about today's remarks, and Dr. Strang references a bit too, but I have to say I felt a lot of emotions over the last few days in particular. A lot of reflection over what's happened over the past 2 years and what we've all been through. I'll personally never forget watching the first COVID briefing with Dr. Strang and Premier McNeil and how surreal that was. I don't think any of us ever thought that there would be 100 COVID briefings, or that nobody thought Dr. Strang would cycle through premiers faster than any other province. But in fact, the day after the election last August, the first call I made that morning was to Dr. Strang. And the first meeting we had as kind of a newly elected leadership team in our new roles was with Dr. Strang and his team that afternoon. So I tell you this just to try to show you the importance of the role that Dr. Strang and his team have played for me and for my team over the last 6 months, and what the province owes him and his team really. They've been guiding us through some pretty dark days over the last 2 years, and I can't begin to imagine how exhausted Dr. Strang and his team are, but I want Dr. Strang and I want the province to know that we will be forever grateful to you and your colleagues for keeping us safe. I don't know, circling back to Pat's question, I don't know if today is our last briefing. We'll always reserve the right to come back to your screens and to be here in front of you as necessary, but we'll always make ourselves available, of course, to answer any questions and address any concerns no matter what. But for now, thank you, Dr. Strang. Thank you, Dr. Strang's team, but thank you to Nova Scotians for everything you've done to get us through these last 2 years, and I look forward to seeing you in restaurants. I look forward to seeing you at rinks and at concerts, at farmers markets, and I look forward to seeing you from the Bayplex to the Mariners Centre and everywhere in between. There are better days ahead. I thank you for everything you've done to help get us there. Thank you.
And there you have it, ladies and gentlemen. Quite a turn of events in this afternoon's COVID-19 media briefing for Nova Scotia. Earlier this morning, we thought we'd have to wait until the middle of May to see if there was a chance that all the remaining Nova Scotia COVID-19 restrictions could be lifted. However, as a result of the briefing just held by Premier Houston and Dr. Robert Strang, all of these restrictions could be gone as early as March 21st, and according to Premier Houston, we could see the state of emergency related to COVID-19 in the province taken away at that time as well. So there's a lot to digest here. Let's go through it bit by bit, because changes are coming very soon. One of them is coming this coming Monday, February the 28th. Phase 1 is going to be changed so that people will no longer be required to show proof of full vaccination to participate in non-essential discretionary events and activities. These include going to restaurants and licensed establishments. Other Phase 1 restrictions will continue, but that'll wrap up at 12:01 a.m. on Monday, March the 7th, as Phase 2 gets underway. That's a full 2 weeks earlier than originally planned. Here's how the Phase 2 gathering limits look. The informal gathering limit will be 25 people from the same household or close social group indoors and 50 people outdoors. The formal gathering limit will be 75% capacity, with physical distancing as much as possible for gatherings hosted by a recognized business or organization. These include special events, sports, receptions, performances, movie theaters, meetings, training, weddings, funerals, and faith gatherings. Large venues can operate at 75% capacity, up to 5,000 people, with physical distancing as much as possible. In terms of the business sector for Phase 2, licensed establishments, restaurants, and casinos can return to regular hours and operate at 75% capacity, with physical distancing as much as possible. VLTs can continue operating with 2 meters of physical distance between people at these machines. Fitness and recreation facilities and recreation and leisure businesses can operate at 75% capacity with physical distancing as much as possible. Personal services businesses like hair salons, barber shops, spas, nail salons, and body art establishments can operate at full capacity with physical distancing as much as possible. Services that require removing masks can be offered at these sites. And retail stores and malls can operate at full capacity. That includes shoppers and staff with physical distancing. In the sports and arts and culture sectors, sports teams can have practices, games, competitions, and tournaments with up to 60 participants, including players and officials. Spectators are allowed following the formal gathering limit. Performing arts can have rehearsals, performances, and competitions with up to 60 participants, including performers and crew. Spectators are allowed following the formal gathering limit. And libraries and museums can operate at full capacity with physical distancing. In terms of mask policies for Phase 2, masks continue to be required in indoor public places. Now, they can be lowered or removed for things like eating and drinking or doing a physical activity that's difficult while wearing a mask. People can resume lowering their masks to eat or drink in their seats at sports games, movies, concerts, and other events. During Phase 2, people who test positive for COVID-19 will still be required to self-isolate, but they will no longer be required to notify close contacts outside their own household. And at acute care and long-term care facilities, restrictions on visitation and in other areas will be determined through infection control and occupational health processes at each facility. At public schools, current restrictions will remain in place until the end of March break. But on that day, Monday, March the 21st, Phase 3, the removal of all provincial COVID-19 restrictions, including at schools, will officially get underway. And if you thought that there hadn't been enough change already, well, we're also going to get a change in how often COVID-19 data is going to be reported to us here in Nova Scotia. The last daily news release on COVID-19 data will be released on March the 4th, and it will be replaced by a weekly update. So there you have it, folks. There's a lot to take in. If you want to get some more information about any of these changes, there are a couple of websites you can visit. novascotia.ca/reopening-plan will give you all of the details for the different phases that are coming in the next few weeks. And as well, you can visit novascotia.ca/coronavirus for any kind of details you might like. And if you have any further questions about COVID-19 or its treatment here in Nova Scotia, or comments you'd like to make about what you're seeing on Telile Community Television, please let us know. You can contact me directly. My phone number is 902-625-8863, and the best email to use is adamjrcook, cook with an E, @gmail.com. You can also contact Telile Community Television directly with your questions or concerns about COVID-19. The station phone number in Arishat is 902-226-1928. And as well, you can reach Telile by email using the address info@telile.tv. And just a reminder that Telile Community Television's Arishat studios are now open to the public. We do ask that you continue to wear a mask for the foreseeable future coming in. Those rules could be subject to change, of course, over the next few weeks, but right now you can come in anytime. Just be sure you're wearing a mask when you do. And that's it for the COVID-19 Media Briefing Local Analysis. Thank you once again for visiting Telile's YouTube channel. My name is Adam Cook, and we'll do whatever we can to make sure that you are informed about the changes coming in terms of COVID-19 treatment and the loosening of restrictions here in Nova Scotia. For now, take care, thank you for watching, and we'll be in touch again very soon.